I'm Gebara. I'm going to be the student nurse practitioner doing your head, eyes, ears, nose, and throat, and lung exam today. So first we're going to start off, I'm going to inspect your scalp and skull. It is symmetrical, there's no rash, lesions. I'm going to palpate for any bumps, tenderness, any induration, which is good. I'm going to palpate the temporal arteries. All right, and then I'm going to auscultate. We can hear any bury. Negative for bury on both sides. And next we're going to move on to the eyes. To test for his visual acuity, I would use the Snellen eye charts. All right, and then I'm going to inspect his eyes and eyebrows. Eyebrows are symmetrical and hair is distributed evenly. Eyelids are non-swollen, no drainage or lesions. Eyelashes are symmetrical throughout, no lesions, bumps, swelling. And the orbital area is symmetric and even. I'm going to palpate real quick, let me know if that hurts. No. All right, his sclera are white and the conjunctiva are pink. Okay. Next, I'm going to look into your eyes with this light. Just going to test his pupil response. Okay. All right, pupils are equal, round, and reactive. And then next, I'm going to do it again to test for accommodation. So into his left eye, I'm going to test his right eye, make sure it's constricting. Okay. Same on the other side. All right, perfect. Both are accommodating great. Next, we're going to do the peripheral. We're going to test your peripheral visual fields here. Let me know, can you see this and this?
Yeah.
And,
Yeah.
and let me know when you can see my fingers.
All right.
Visual fields are intact. And then we're going to do the 6 cardinal fields of gaze. Just follow my finger without moving. Follow my pen without moving, and just with your eyes. Go over, up, down, up, center, over, up, and down. I'm going to have you focus on the pen and just follow with your eyes to what comes to center. All right, beautiful. Next, I'm going to do the fundoscopic exam with my ophthalmoscope. So I'll come in at a 15-degree angle and with my right eye to visualize his right eye and go into the pupil. The pupil has a positive red reflex, so go in and look at his retinal vessels and follow them into the optic disc, which is clear, which is white, round, with even or sharp margins. And I'll do the same thing on this side. With my left eye, looking at his left eye, positive red reflex, go in, follow the retinal vessels to the optic disc. Okay, good. Next, we're going to move on to the ears. I'm inspecting the ears. In the pinnae, everything looks good, and the surrounding skin looks good on both sides. All right, I'm going to palpate your ear and let me know if you feel any tenderness. Good, palpating the tragus. I'm going to pull a little bit, and let me know if that hurts. I'll do it on the other side as well. Pull. Oh. All right, next with my otoscope, I'm going to just look into the external canal. There's no redness, swelling, drainage, any lesions. And look into my landmarks. The pars tensa, flaccida, and the malleus. And look at the tympanic membrane is clear and gray, a pearly gray, and the cone reflex will show in the anterior inferior portion of the tympanic membrane. And I'll do the same thing on the other side. In through the external canal, no redness, swelling, any lesions. Looking at the tympanic membrane, it is also a pearly whitish gray on the side. No swelling, redness, or bulging. All right. So next we're going to do a Weber test, which is going to test your bone conduction of your hearing. So I'm going to tap this and you tell me when you can, which ear you can hear it better on.
Both are good.
Alright, so bone conduction is intact. And then next I'm going to do the rhyme test, which will test your air conduction versus bone conduction. So I'm going to tap this and then tell me when you can stop hearing it.
Alright.
Can you hear it better with this ear?
Yes.
Alright, so air conduction is greater than bone conduction. I'll do it again on this side. Tell me when you can stop hearing it.
Alright.
And can you hear it better now?
Yes.
Alright, air conduction is better than bone conduction. Greater than bone conduction. Alright, so we're going to move on to the nose. The nose is midline, not deviated. I don't see any, the nares are even. I don't see any redness, any drainage. I'm going to palpate the bridge of your nose. Is that hurt at all? No? Okay, and then I'm going to palpate and feel your sinuses. Frontal, does that hurt at all?
No.
Maxillary,
No.
and ethmoid.
No.
Okay, and then if they were swollen or anything, we could do something called the transillumination, where we would dim the lights and use the illuminator, and we put the illuminator up here and on both sides, and hopefully there would be no dullness, and you'd be able to see the sinuses. And then for the maxillary, to have him open his mouth and on the hard palate, put the transilluminator in to see the maxillary sinuses as well. Okay. And then I will, with my otoscope, I'd look into his nares, have his put his head up, and there's no, the mucosa is good, there's no drainage, redness, swelling. The turbinates are not red or pale. Okay, I think we're good there. All right, next we'll move on to the mouth and throat. Lips are pink, non-dry, no lesions. I'll have you open your mouth. Buccal mucosa is nice and pink. His gums are pink. Can you stick your tongue out? Tongue is pink. Can you open your mouth and say ah?
Ah.
All right, positive uvular movement. I can see the parotid gland opening at the back of his tongue, or back of his molars, in between. Tonsils are not red, no exudate, no swelling. And then we'll also see your hard and soft palate, and looks good. No no redness, lesions, or exudate. All right, on to the neck. Neck is symmetrical. I'm gonna go and the trachea is midline, and I'm gonna go ahead and feel for your thyroid from behind, and right, so there's no swelling of the thyroid, no goiter, and the isthmus, and then I'm gonna have you swallow. All right, there's normal up and down motion of the thyroid. All right, now on to the, I'm gonna palpate your, I'm blanking. This is, I'm gonna palpate your lymph nodes now. Okay, we have your tonsillar, submandibular, sublingual, anterior cervical, posterior cervical behind the sternocleidomastoid muscle, and then your cervical, which are not inflamed. Good there. Okay, and then going to move on now to the chest and lung portion. He's breathing comfortably. His respirations are non-labored, no nasal flaring. All right, so first what I'm going to do is just palpate your thoracic muscle. Oh, and his curvature, he has normal thoracic curvature, and it's symmetric on both sides. All right, so just palpate for any crepitus or any crackles, which we do not have. And then test for tactile firmness, I would just put my palm, or the end of the palm of my hand here, and ask him to say 99.
99.
do that throughout each side and on back to test, and hopefully it's even and symmetrical throughout. And then I can also palpate his lung fields for resonance and hope the dull areas are his organs. Hopefully there we go. And do the same to the back and not over the scapula because and then I'm going to test for the thoracic expansion here. I'm just going to, yeah, sure. I'm just going to have my hands, I'm going to have you take it in. And out, exhale, and in again. Thoracic expansion is symmetrical. Alright, you can turn back this way. Okay, so now I'm just going to listen to your lung sounds. Alright, I'm going to start with the anterior. Dig in and out. Alright, then listen to your back. Okay, his lungs are clear with no adventitious lung sounds. And that's it.